I have intermittent, my screen froze about 3 minutes ago for about 5 seconds. So if I freeze up, just roll with it. It comes with the territory. So next slide. I'm going to, this is the three suspects here. We've already been introduced. I will talk about moral foundations theory, an overview of that. Barbara Alvarez-Martin will talk about how this material fits with elected officials, which I think all of you are very interested in. And we will do a breakout room after the two of us present. Then Dawn will present on health equity, systemic racism, and how to frame messaging in that environment. And we will have another breakout session after that. So next slide then, just going really quick. This is our network website. The PowerPoints are available. You can, if you want more, you can find it on our website on messaging and on COVID and health equity. Next slide. Just real quick to set the stage. You don't need too much of a primer on this. Major public health events. So 1954, the polio vaccine. I just froze up. Am I froze? I froze.
You're back. You did freeze, but you're back.
All right. Swings in cultural cohesion in this country. We were cohesive 70 years ago around polio vaccine. 1981 with AIDS, we were very divisive. 2001, we generally responded with cohesion around dealing with anthrax attacks, the bioterrorism, and to rebuild public health emergency preparedness. And then we got COVID, and here we are. Next slide. So we are sitting in the middle of a bullseye with the COVID pandemic, with the economic crisis it triggered, with the systemic racism that it illuminated with laser beams, with the problems in our democratic process due to the polarization, social media, etc. And then hanging out there is climate change, which feeds into all of this. So we have our hands full. Next slide. In addition, public health is really not prepared for the fact that we became weaponized during this COVID pandemic. And so we're rather unskilled politically at dealing with this puzzling terrain. Next slide. So in addition to that, we've got the complication now in the 21st century that our 21st century brains just naturally all prefer a simple lie to a complex truth. We in public health are screwed, because we don't have simple, short truths. We're dealing with nuances and a dynamic changing situation. So next slide, what must we do? We need to build our inside game. We need to rebuild our political with a small p skill set of how we do advocacy in our workforce and with our leadership. And number two, we've got to build the outside game of our allies, develop allies other than talking to ourselves. So moving right along, next slide. This is again from our website. You can get more material there. Next slide, I will just quickly pass over one framework of how you change law and policy with an interdisciplinary approach. And those three circles in the middle, you've got to select what policy solution you want to spend your political capital on. The middle one, you've got to then do the advocacy necessary in order to make it happen. And the fourth one there, you've got to enforce, implement, and defend. Otherwise, it's just an empty words on a page somewhere. To do that, you need good messaging. Otherwise, we're lost. So next slide. Let's talk just quickly about Jonathan Haidt and moral foundations theory. Y'all took a little self-assessment questionnaire, which Elizabeth is going what Barbara is going to show you just in a minute what your results were. And you also saw a video from Jonathan Haidt, who developed this field of moral foundations theory about almost 10 years ago now, on how most of our social and political judgments are
Gene froze again.
and 10%.
You're back.
I did it again. I'm sorry. What'd you miss? Who knows?
We're good. No, you're
okay.
good.
About 10% of this is our rational brain that thinks it's calling the shots. But in fact, our frontal lobe is sensing the way our intuitive elephant is leading, and we tend to go that way. So Haidt did some really, really interesting research, shown on the next slide, where he identified 6 foundational values that we all intuitively resonate to one degree or another. And you saw them in the little 8-minute video where Haidt explained it. I'll just refresh again. Each one sort of is on a spectrum. So care and harm, we all, to some extent, have compassion for the vulnerable and intolerance of suffering of others. Number 2, liberty and oppression. We're a very curious species. We like to wander around across the Serengeti Plain and see what is there. And so we like to have that freedom. We need our liberty. We don't need to be told what to do. You folks have been hearing this a lot recently in Iowa, I'm sure. And similarly, we don't tolerate bullies very well. So number 3 is fairness and cheating. We want to be treated fairly. We want to get what we deserve, and we don't tolerate free riders very well in our system. Loyalty and betrayal, it's the personal trust that we have with our family, our extended family, our neighborhood, our community, our town, our football team, our state, whatever. And in this era of social media, we can move identity groups with a click of a mouse in a millisecond. And we don't like those who betray. 5th one is authority, value, authority and subversion. It's the competitive advantage of groups that have good leaders. The symbol there is Alexander the Great, who didn't enslave and kill people that he conquered. He said, come join my big red team and we will go off and I'll make you part of this and we'll go conquer other areas and you could be all part of this. That good leadership outcompetes a group that is anarchy. And so we don't tolerate very well those who subvert our systems. And then finally, sanctity and degradation. That's religious values, but it's more than that. It's a part of the human spirit that's elevated and pure. And we touch on this when we go into deep time at births and weddings and deaths and graduations and all these deep events in our lifetime. And see that. So next slide. Haidt then did some really, really interesting work. He found that these 6 values could be measured. And he did a number of different cultures, and he came back to the US and he found this interesting thing that a US population, there's a really significant difference in how political liberals and political conservative resonate to these 6 intuitive values. So here is how liberals played out. Liberals are a very much their overarching value, overarching goal is care for the weak, to help those in need. So liberals score high on care, liberty, and fairness. You're going to see an example of that in yourselves shortly. And liberals tend to rate lower on those 3 values of loyalty, authority, and sanctity. Now, conversely, if you look at the slide on conservatives, conservatives are very interesting how they pull out their normal, their overarching goal is to preserve the norms and treasured institutions. So they score high on those three values on the right of loyalty, authority, and sanctity, but they also score very well on the first three values to help those in need: care, liberty, and fairness. Okay, if you put these two groups together on the next slide, then you see that there's an interesting discrepancy illuminated here. So first, if you look at the liberals in blue, they know that they score high on those first three values and lower on the second three, but they don't believe it that conservatives score high on care, liberty, and fairness. They're only interested in acquiring wealth and keeping it from themselves. They don't give a damn about care, liberty, or fairness, but it is not true. Okay, it's a misperception of the liberals. Conservatives, on the other hand, they know their profile is as shown there. They also accurately know how liberals do not resonate as well to loyalty, authority, and sanctity. And they also understand generally that liberals misperceive conservatives to think that conservatives do not resonate to care, liberty, and fairness. And so this creates a sort of a conservative advantage that Jonathan Haidt talks about, of how in the world do liberals in this country get anything done when they're essentially playing with three cards in a six-card deck. Now, there's another piece of this that we're going to get to in just a minute about, just click on the slide, Dawn. It also gives us insight into the public health advantage in this moment, because on the following slide, you see that, let's stipulate for the record that public health tends to attract liberal do-gooders. I see we generally are, but there are exceptions which should be highly valued in our professions who are conservative. And so we tend to resonate and frame our messages around care, liberty, and fairness, but we also are finding that public health workforce also resonates to a lesser extent, but better than the Haidt data on the general population, on loyalty, authority, and sanctity. Loyalty, the heart of public health, is community coalition building. This is what you folks on the screen are doing every day out there. We're loyal to our communities. Authority, public health is a police power doctrine. We will quarantine your ass if necessary in order to protect those in our population that you pose a risk to. And so we do, quarantine and food inspection and closure of facilities, etc. And then finally, sanctity, the nobility of public health is that when others are running away from the fire, we run towards Ebola or COVID. And you folks have been working, you can't fool me. You guys have been doing this day and night for 20 months now, dealing with COVID. So that sort of says it all. So just to close, and let me get off your next slide. Public health and community discourse, just advance the slides through on this, Dawn. The heart of public health is community coalition building. And so we can add value to the community dialogue shown on the bottom arrow. Click one more time. We need the community, we need civil discourse to take place in order to work with our communities, and we can add value to the community dialogue taking place. So the next slide here shows deeper training that we do. I think Deborah's going to use this particular format on a session she's going to do with y'all later in the month. But the point too is that this training is good for leaders doing advocacy. It also helps frontline public health workers. So while Barbara is coming up now, just next slide, just put in the chat box, which foundational value do you believe is the most difficult for you to use when you frame your message? Oh, there you go. All right.
Yeah, you have a poll showing up. You should have a poll. So I will watch the time and close it probably when it looks like most people have participated.
How do they get into the,
You
is the
should
link
be
there?
seeing the poll. And so you just respond on the poll. Is anybody, somebody has responded. So at least one person can see the poll.
Okay.
Don, I think maybe with so many people as co-hosts, we maybe didn't. I think that
I
may mess
didn't.
up the poll.
The poll showed up and it disappeared almost instantaneously.
Oh, then someone might have actually closed it. That's
Okay.
Can you relaunch it?
Let me see if I can relaunch. Sorry about that. I think it can be a challenge when there are multiple co-hosts. Let me see. Relaunch. There we go. Okay, I am not touching it. It should be open. You can vote.
There they go. There they go. So
And I think
Barbara,
that
why
maybe the
don't you
co-hosts
introduce
are not able to
yourself?
vote.
Yeah. Barbara, while
Okay.
they're voting, go ahead and introduce yourself.
So I'm Barbara Alvarez Martin. As was described before, I have been in public health for 30 years, but I hit 50 and just thought, what the heck? Let's go back and get a doctorate. So I just completed my doctorate in public health and focused on this topic. How can we improve public health communication in a politically polarized environment? And I explored the use of moral values in message framing. I did I took a look at both public health practitioners in North Carolina, had over 500 North Carolina public health folks take that moral foundations assessment, as well as local elected and appointed officials in North Carolina. So I'm going to show you a little bit of data about that once we close this poll.
So the results are there on your screen. An equal split between authority and sanctity for this crew, with a few votes here and there.
That's really interesting.
Okay, so I will move you forward.
Perfect. Okay, so we're going to get to your results first. So 64 of you completed the Moral Foundations Assessment. Thank you very much for doing that. And on a 1 to 6 scale, this is your composite score. So not surprisingly at all, y'all scored the highest, almost 5 out of 6 on care and fairness. You were the lowest collectively on sanctity and loyalty. Notice that my graph is a little different from Jean's. Liberty is at the end, and you'll see in a little bit why I did it that way. But clearly, care, fairness, and then liberty are the 3 that are the highest for you, and loyalty and sanctity.
They're a bunch of libs, Barbara. They're a bunch of libs.
Can you imagine a bunch of libs in a public health group? All right. Well, I also put your numbers up with what we found in my research with public health officials. And so here you can see you are in green, you 64 folks. And then you look obviously very similar to the North Carolina public health practitioners. Those are also very high in care and fairness. And then next highest in liberty. Interestingly enough, and I haven't run any statistics on this, I don't know if it's statistically significantly different, but you are visually lower than your public health counterparts in North Carolina on loyalty, authority, and sanctity. And you can see for the blue and the orange bars in my research, I was looking at public health practitioners compared to local officials. And one thing that I found very interesting in my research is we were expecting, frankly, that in public health, we were all going to be high on care and fairness and then low on what we call, and what I should say, what Jonathan Haidt calls the binding foundations. Loyalty, authority, and sanctity are considered binding foundations because the sort of the nexus for values there is the family, and these 3 moral foundational values, loyalty, authority, sanctity, are what bind families or groups together. So conservatives score higher on those, and local officials who were more conservative definitely scored higher. But I want you also to look overall at the orange, and you can see that care and fairness are still the highest for local officials. Now, granted, these are folks in North Carolina, and we would want to replicate this in other places. But I was pleasantly surprised, pleasantly delighted that there is opportunity to communicate and to resonate with local officials on a variety of issues, including care and fairness. So if you go to the next one, Dawn, so now this is getting into my research. So this is looking at the 500 plus public health and local officials overall. I did a lot of statistics, running them, comparing the two groups, and did both bivariate and multivariate analyses with them, making sure that to control for any interactions between whether you were a public health person or an elected official. We found very little difference statistically where I needed to control for that. So putting all of those folks, 500 together, not surprisingly, this also completely was in line with what we found, or what Jonathan Haidt found, and that is conservatives tend to score much higher on loyalty, authority, and sanctity. For each one of these bars, red compared to purple, which is moderate, and compared to liberal, which is blue, each one of those differences was statistically significantly different, except for the two that have boxes around them. And so you can see that liberals score highest on care and fairness, and it's sort of a stair step with moderate scoring in between, and liberals scoring the lowest on those binding foundations of loyalty, authority, and sanctity. So we have a question, another poll question for you, because I'm going to get into a little bit in demographics in the 3 minutes that I have left. So which group do you think resonated most with the moral foundational values? So thinking about just age now, was it the older folks who resonated with most of the moral foundation values? Was it the younger folks? Was it both? Was it neither? We've got 26. We'll give it just a few more. Y'all are quick. A lot of people hedging their bets, saying both. You're probably on, and it can't be neither. It's got to be one or the other, right? Or both. Okay, so we've had about 46, almost 88% of people have participated. And interestingly, y'all are between older at 43% and both at 30%, 37%. Well, let me move on to the next one. Those of you, the 20 of you who said older, were right. So again, in North Carolina, we found that the older folks who answered the survey, so those who are 70 and older is the darkest blue bar here, that for each moral foundation, we compared those who are 70 and up with every other age group, 20s, 30s, 40s, etc. And for each one of them, the older folks had significantly higher scores across every moral foundation compared to the other age cohorts, except for those three little ones that have the little caret ahead. But otherwise, the 70-year-olds were significantly different from all the other age groups. And so the implication, I think, here is that public health practitioners may have more opportunities to connect with older elected officials across a broader range of moral foundational values. So I think that's one good lesson learned. Next slide. I also looked at differences within education. And again, I compared high school or associate's degree, those are the ones in yellow, with either bachelor's degree or graduate degree and higher, again, with this entire sample. And where you see the little asterisk, compared to those with lowest level education, we find mostly on the binding foundations, loyalty, authority, and sanctity, that those with higher degrees actually had lower scores. Or said the flip way, those with lowest level of education or the highest on those binding foundations. And you may recall that this is a pattern that was similar to what we saw with political conservatives. So again, I think there are implications for when you are working with folks who have lower educational levels. You need to be thinking about communicating across all 6 moral foundational values. So a few takeaways. I spoke for 30, 40 minutes on all of the findings of my research. I just wanted to highlight a few here for you. But I think a couple of key takeaways here. The first one is that, again, at least in North Carolina, but I would hope that it would be the same in other places as well, that public health has more in common with local elected and appointed officials than we originally may have realized. And I think that that provides openings for us to be able to talk on a variety, using a variety of moral foundations. The second key takeaway is that it's really important for you to know your audience and to speak to their values. Oftentimes in public health, we've got that righteous indignation and we lead with what we want to be talking about, and it's care and fairness. And in some cases, we need to be talking to other values instead. So sub-bullets under that is, one, we found that those with the lowest educational levels have moral foundation values and a profile that's similar to conservatives. So we need to be thinking about that. And that older folks are higher on all moral foundations. So I think the subtext, which is key takeaway number 3, is that we, and particularly our youngest in our field, may have some blind spots when talking with political conservatives. And that's where training like this, or even working on some of the, just having practice in this area and recognizing our blind spots is going to be really important. All right. So going back to what we must do, I'm going to kick it back to Jean, and then we are going to have a breakout group.
Yeah, and I've sort of already touched on this, but I think it reinforces we need to rebuild our political skill set internally and think through how deeper we can do messaging from our bully pulpit. And then others, we need the outside game. We need to build the allies and alternate forces to support us. So I think that's it. So Dawn, you want to take us to breakout and how we operate here in the next 15, 20 minutes?
Yeah, I am not actually going to talk very long because I want us to go to breakouts. We are a little over off, about 5 minutes off the agenda that you see here. So we will still have a 15-minute breakout and reconvene and share. We'll save 5 minutes in the next section. So you will have instructions in your breakout rooms with, and every room is assigned a leader, and you're going to come back and share 1 or 2 big takeaways, and then we'll have a break.
Okay, and this is Lena again. I am in the process of assigning breakout rooms. We weren't able to pre-assign them. So just give me a few minutes. We're gonna do a random assortment, and then I'm going to shuffle the facilitators. So just give me a few minutes, take a breather and explore the network website if you'd like.
Okay. This is our unanticipated break, huh? Anybody got a question they can throw in the chat box? We ran
Actually,
through.
we had one, and I was just saying we would cover it after the break, but since we have a moment here, Danielle asked the question, let me scroll back up. So why are conservatives against the mandates if they support authority more? That's a great question. And I actually did literature reviews on lots of different situations where moral values were used to address how to gain more support for particular issues. And most of the research has been around, interestingly enough, environmental issues. So how can we frame messages to get more support for environmental issues like recycling and using the new kinds of light bulbs and that kind of thing. And one of the key takeaways that I remember that really resonated with me is that we can speak to values, but there's also who is speaking, and that the resonance, what we will call, well, I won't go into that, but just the fluency of a particular message. The values can be trumped, the message itself can be trumped by who is speaking. And I think there have been so many dog whistles from folks on the right that have undermined the authority of public health, the resonance with the authority value, because they are looking to sort of within their own tribe, who is the one who's speaking? And if it is folks who are downplaying and degrading the vaccine mandates or sending mixed messages around, COVID in general, that kind of trumps the actual value. So that's one answer. Jean, did you want to add
I think
anything
it's
to that?
just
Or
public
Don?
health got weaponized, and COVID is just sort of overriding everything here. And it's a chaotic environment.
Okay, it looks like everyone's back. So I think over to you, Deborah.
Okay, so everyone is back from the breakouts. Hopefully each group had a reporter identified. I'm going to begin with my own group and put Sarah Strawbridge on the spot to start us out. Sarah, what did we talk about?
Yeah, thanks, Deborah. We had a really good discussion. I think, right at the end as well, talking about how the very first example that was shared definitely was our knee-jerk reaction, something that we could all see ourselves saying. Although, Deborah took us through a great facilitation process of going kind of sentence by sentence and deconstructing it and thinking about, okay, what is it about that sentence? What are some of those key words that stood out to us, like to care for others, citizens, how that citizens is actually more of a global reference. And then again, thinking about your audience, anchor it more to our friends and family, right? That makes it more real and personal to me. I may not care about my neighbor down the road, but I definitely am concerned about my friends and family. So yeah, really good, robust conversation, really kind of thinking about it through a whole different lens. Do you want to call out a couple more specific words or pass the torch?
Well, we've got a lot of groups, so I think that's a good start, Sarah. Thank you for that. I would love to hear from another reporter, and I don't know who you all are, so I'm relying on you to speak up now, please.
Throw Amy Greer onto the bus. She was our reporter.
All right, Amy, you've been thrown under the bus.
Thanks, Jean. We also had a very lively conversation about identifying and possibly replacing some of those words and phrases using some of the techniques that we used earlier, and like the value system, and a couple of the ones had to do with our duty, and also turning something. There was something that mentioned COVID as a threat, and that could be used kind of in the same as I'm understanding the lingo that we use when we're talking about there's a bomb coming, or so we're under threat. So perhaps that could help us in that. And the third thing had to do with do any of my friends want to fill in the blank on that?
Well, that's okay. I'm going to move on to one more group because we are behind schedule already. But Amy, you did a fantastic job. And I think that we all have a lot to contribute. But for the sake of time, Mark Dodd is on my screen with his hand raised. So Mark, maybe time for your group, and Lena can tell me if we have any more time or if we need to move on to break.
Sure, thank you. Very quickly, I would say that in summary for our group, it was interesting and it generated a lot of conversation to see 3 different versions and to have certain words highlighted. I think the 3rd version had some different language included in it as opposed to the previous 2 versions. None of the versions that we looked at really did we feel crafted a message that addressed all or even, most of the foundation theory categories, or at least in a way that we felt would resonate, with a broad audience in that way. And I think we all said it was really a great exercise to think about that and to realize that we've got to get input from others on the messages, right, that maybe are on that opposite side of the continuum before we launch, the messages publicly or even approach our public officials.
Very good, Mark. I love that observation. It's really about getting out of your echo chamber, and we all have one. Okay, how are we doing on time, Lena? Do we want to take one more report out, or should we?
Yeah, I think we can do one more, and then people can put their comments in chat. Sorry to cut this part short. We, like I said in the beginning, we have greater interest than we had anticipated, so it cuts down on our reporting back time. But do share your comments in your chat, so we want to hear them.
Yes, and this is more of what we'll do in those sessions coming up in October is the think out process, because boy, is it helpful to have a sounding board on this. Trust me, Angie's been mine for years now on it. So I have Heidi Haynes next on my list. Heidi?
Hi, we just had one version, so I know Mark spoke of 3 different versions, but we did, notice the emphasis on caring, that it tended to be more towards the liberal side. It kind of tried to, be in between, so it was a little wishy-washy. There was more perhaps declarative statements about if we want to get back to normal, should be X, Y, Z. Focusing on at-risk individuals instead of, again, what someone else said, what's in it for me, that this affects everybody and how is it affecting everybody, and maybe having it be shorter. It's a little long. Did I forget anything that was key points in our group? No? Okay.
I think that's good, especially for not having all 3 slides in front of you. Let's see. Okay, so I think Lena will send us out to break now. It sounds like everyone did a great job of having some robust discussion. So thank you for participating in that way.
Yeah, we'll go ahead, and we're a few minutes late for break. Apologize for that. We recognize the importance for people to take a stretch break, bio break, whatever you need. If you want to stay on and continue chatting, please do so. Otherwise, why don't we reconvene in about 5 minutes here, and then we'll turn it over to Dawn. Record it again. I'm sure people will be anxious to see the recording as well. So Dawn, why don't we turn over to you to get started, and we'll let people filter back in at the same time.
Yeah, I am going to probably go through some more through my section more quickly so that you have more time in the breakouts so we can preserve that time. So this is really just, it's been on the screen, so hopefully you had a chance to read it, but the idea about really normalizing conversations around race and racism, if we're ever going to get to a point where we can work on it effectively, and understanding the importance of framing communications in a way that doesn't reinforce negative perceptions and stereotypes about people of color or other population groups. So, yeah. Okay, so I am actually going to start with a quick poll. Among the unvaccinated, you can read it because I have things popping up all over on my screen here. Here we go. True or false? Among the unvaccinated, more Black and Hispanic people prefer to wait and see how the vaccine is working, while more white people report that they definitely will not get the vaccine. So let's see, almost everyone has responded. This is great. So I'm going to end the poll and share the results. So most people think this is true. And I'm going to show you the answer on the next slide. Well, I'm going to show you part of the answer. It is true. And so this is from the KFF COVID-19 vaccine monitor, this particular image, but their monitor has consistently shown that among unvaccinated folks, Black and Hispanic people are more wait and see versus white people. And the definitely not going to get a vaccine is overwhelmingly conservative and rural. And the wait and see group is more politically mixed. We also see, and what you see here is that opinions are strongly connected to past flu vaccine behavior and overall views of the pandemic. So not surprisingly, if you don't think the pandemic is that serious, you also don't really see the importance of getting vaccinated. So I share this because it's important to think about how we include data in developing our messages and thinking about the fact that, you know, all people don't fall, even within a group, don't fall within the same category. So we say we want to develop messages for the unvaccinated. That's nice, but all unvaccinated people don't think the same thing. So making sure you take these kinds of things into account. So this is really just why and what it means and why we do it. So we either want to share information about equity, things that are equity issues, like how a community is being impacted, or we want to focus on equity as an outcome of the message. So we want to get people to do something that will improve equity. And then lots of reasons to do that. I mentioned normalizing conversations around race and reaching people where they are is another important one. And I just encourage you to think about your own reasons for why we want to center equity. And I know during that little break there, people were talking about the importance of tailoring a message to the community for it to resonate more. And I saw that in the chat as well. So I'm going to go through these steps here. So I'm not going to spend a lot of time on this slide. And but this is the order that we're going to go through. So the first thing is to know your audience. So you've heard Barb and Jean talk about this, but really identifying what your audience values and what their tipping point is. You've heard me, if you've seen me present before, I mentioned this book. I like it a lot. It does have a lot of good public health examples in it, including a 90s epidemic of syphilis in Baltimore, teen smoking and suicide, and uses those along with lots of other examples to illustrate the ways in which epidemics can be tipped. And so the other part of this is also about why are you trying to reach people in the first place? So do you want them to change their behavior? Do you want to just get information out into the universe? Do you want, you know, what is your purpose in reaching out to people? And also any of these tips apply no matter what the size of your audience is. So you're talking to 100,000 people, you're putting something out in public airways, or you're talking to your neighbor who still hasn't decided to get the vaccine. So you can visualize your audience in different ways. These are two different models that I have used, collaboration continuum and the stakeholder management model. But basically, you know, you're looking at people on the right side of the screen here who are going to help you with whatever your movement is, right? And you're not necessarily trying to message them because you're not going to create an epidemic. You're not going to tip a movement by speaking to the people who are already on your side. They're already going to do what you want them to do. So you're really trying to speak to people in the middle. Curious people, aware people, neutral and supportive people. That's who you're trying to target with your message. And people who don't believe that COVID is real or think that vaccines put microchips into your arms, that's not who you're trying to tip. They're pretty entrenched in those beliefs and they need a different kind of messaging. Same thing with unaware people. If they really just don't know what's going on, you're going to have a different approach to working with them. So I'm really talking about how you reach this group in the middle. And this is from the opportunity agenda, which is shifting the narrative to advance racial equity. And so they did a study on, I did a national poll actually. And what they found was that most people fall into this category of persuadables. And then you have your base, which for the previous slide is the people on the right, and the opposition, right? People who are resistant. So most people are somewhere in this 50% category of persuadables. And interestingly, they found that people who are in this group reflect the demographics of registered voters for the most part, with a slightly more Latinx lean. And the other important part is that they found that people who are in this group hold beliefs from both the base and the opposition. So keeping in mind about the ways that things resonate, that you can appeal to things that they might believe, they might not think COVID is that serious, but they also, you know, believe in caring for their community, right? So how do you appeal to the things that this group holds, the beliefs that this group holds? So my suggestion is that we start with knowing that, assuming that most of us want the same things, identify how other people define the same concepts, and then engage people that using language that's relevant to their perspective. And so what this looks like in practice is arguments for a higher minimum wage. I like to share this tweet that talks about Florida voting to raise the minimum wage here, which actually went into effect on the 30th of September, and to re-elect Trump. And he says, you know, most voters are socially conservative and economically liberal, and they fall into this upper left-hand quadrant of this graph, right? But messaging is often, today in particular, these days, in the upper right or the lower left, right there, it's either targeting conservatives, it's targeting liberals, it's not targeting this kind of heterogeneous group in the middle. And so some of the examples of why people might want a higher minimum wage are listed here. And what I would, you know, propose to you is that someone who believes that minimum wage increases are good so that we can reduce reliance on public benefits probably does not really care about pay disparities for Black and Hispanic and Latino and Indigenous employees. They could be the same person, they're probably not. And so these are different things that you would message to hit that group that's more diverse in terms of, you know, what they value. And so you want to think about all the different things, all the different reasons that people might want to have a higher minimum wage, in the same way you want to think about all the different reasons that people might or might not want to get vaccinated. So one of my big tips always is to focus on systems, places, or conditions. And instead of, for example, saying African-American people in this community have more cases of COVID-19, which may be true, you want to say COVID-19 is more common in communities that have a higher risk of asthma and COPD due to environmental hazards caused by redlining and other intentional actions by the government to segregate people into communities that are at higher risk. Why do we want to do that? Because we want to focus on changing the thing that can actually make people healthier. Individual behavior change is not going to lead to overall better community health. And so we want to focus on the systems, places, and conditions that create inequities. On the left here is Brittany James. She is a physician and founder of the Institute for Anti-Racism in Medicine. And she says, instead of the healthcare community asking how we can get Black folks to trust us, we should instead be asking, how do we become trustworthy? As all of us, our institutions should be doing that. It is not our responsibility to fix what you did to violate the trust of the people that you serve. On the right, this is one of my favorite articles. It's from last summer, how decades of racist housing policy left neighborhoods sweltering. It doesn't talk about the fact that Black people live in these neighborhoods or Hispanic people live in these neighborhoods. It talks about the fact that housing policy is directly linked to the fact that these neighborhoods don't have adequate tree cover, which has led to, and they're also very dense, densely populated. And so it's led to this, you know, condition where you have these really hot communities. And that's a danger in terms of people's health long-term. And so this article does a great job of pointing out that systemic issue that has led to that, the issue that's impacting those communities. So I want to give credit to Elizabeth Thomas, who normally presents with us on empathy, but what she says, you know, here, which is something that I try to emphasize as well, is focusing on themes and not episodes. And so that's along the lines of what I was just talking about, like what is the bigger picture issue? And you also want to frame it in a way, again, that does not focus on the individual, especially individual acts of heroism. You know, we don't want to reinforce personal responsibility. The other part of this, I think, is when we talk about personal responsibilities, like when the CDC, Rochelle Walensky said, your health is in your hands, that was an example of really poor messaging for lots of reasons, but one of which is, no, my health is in your hands as the lead public health agency in this country and who guides other public health agencies throughout the US. You have to put out better policy. It's not our job to make this, to deal with this pandemic on our own in our communities. So the other part, one other important thing is to use asset-based framing. We're going to talk about this in our breakouts, but that is leading with things that focus on things that are positive, things that are strengths, things that are our aspirations and contributions, rather than focusing first on deficits and challenges. And we do this because when we lead with deficits, we often reinforce our intuitive elephant that you heard Jean talk about, right? We reinforce these beliefs that we have, these natural assumptions that we have about people and communities. And so a couple of examples of what that could look like are vaccine hesitancy versus vaccine enthusiasm. So we focus a lot on who doesn't want to get the vaccine, but we're not really messaging the kind of people who are getting vaccines and why did they get it? So this is a good example from an organization called Step Up, and they their mission is to reduce their mission is to help prepare girls, right, for successful future lives. And so they used to have this statement that said, we seek to reduce dropout rates and end the dropout crisis. So that is an example of not using asset-based framing. So they did some intentional work around creating asset-based messages. And so a couple of those are on the right, but we work with girls to prepare them for graduation. We Step Up teens support each other in graduating from high school on time and are ready for the next step, right? It may be true that you want to reduce dropout rates, but it's more motivational, especially to the girls who are in your program, to say, we want to prepare you for a future in which you can be successful and have healthy families, have homes, whatever it is, right? We're giving you what you need to be successful in your life. Another example of this, Frameworks Institute, I'm not going to read these, but Frameworks Institute has a great series right now on framing COVID-19. This is one part of their series that talks about using moral argument framing, which is what this whole thing is about here, versus vulnerable groups framing, right? So not focusing on, as we often do, Black people are affected, older people are affected, poor people are being affected, or people living in poverty, I should say, versus moral argument framing, which is, what is the right thing to do? How do we appeal to what people value? And let's focus on that as a motivational factor in our message. So, question for you, if I can get my poll to show up, is which of the MFT values do you think is most likely to come up in a discussion about racial equity? I'm going to launch this poll and I'm going to look at my timer. Okay, I'm good. See some people in the chat too. Okay, we've got most people. It seems like there's a pretty strong trend here of fairness. Most people think fairness, care, liberty. I would say yes, those are true. Fairness is probably the most likely because fairness is a word we associate with equity and equality. But depending on what your message is, you would definitely appeal to all of these. And so all answers are correct. And very quickly, I'm going to talk about storytelling. Storytelling is important because people remember information through storytelling much better than in other ways of just giving them facts or something like that. So one example that I like to share is ER. The TV show, I know that makes me older since I'm not a Grey's Anatomy fan, but I am an ER fan. But they had an episode on HPV and its connection to cervical cancer and the importance of understanding that link. And so they did a pre and post, basically, I think 6 weeks after the show, and demonstrated that not only did people understand the connection between HPV and cervical cancer when they didn't know it before, they retained that information 6 weeks later. Right, so storytelling is super powerful, and it's also how we can appeal to people's values and beliefs, and make a connection with people before trying to give them information. So I like the phrase that I heard, which is people want to know that you care before they care what you know. That's something important to always remember. I won't spend a lot of time here. You may have seen Brandon Boulware, who was talking about his transgender daughter and her brother playing in the front yard. His daughter was wearing a dress and wanted to go play with the neighbor's kids, and her dad said no. And then she asked if she went inside and put on boy clothes if she could go play. And he realized then in that moment that he was equating being good with being someone else and teaching her to deny herself. And he said that changed everything. And so it led to him being there and testifying about that. And, that's a story that you can remember. And as a legislator and policymaker or someone who influences policy, you can remember like how this really impacts people's lives and why the laws that we consider matter. It's a way that we can tell the story about the story of public health. And so in the interest of time, I'm not going to tell you about this one, but I would encourage you, if you don't follow Humans of New York, to follow it. It can restore your faith in humanity at a time when you probably have lost some of that. So the next kind of tip is to be authentic, and that means using language that's meaningful to your audience and meaningful to you. I saw in the chat somebody say code switching, but it's really important that you talk to people in a way that matters and resonates with them. And that means sometimes you aren't the person talking. So you want to engage trusted community partners to deliver the message. You want to use translators and interpreters, and you want to censor the voices of impacted community members in your conversations. These two examples on the right were created during the pandemic to reach Black and Hispanic or Latino populations. So the conversation between us about us, which is Black physicians talking about COVID vaccines. And this is the Juntos We Can Stop the Spread of COVID-19 campaign from Salute America on the bottom. So I like to spend some time on this. I won't spend a ton of time on this. You will have these slides, but I like this because, you know, it's really important as we think about values that we also think about our biases. And so the things that influence the way that we message and how our message is both delivered and received. So confirmation bias, meaning we are more likely to believe something is true if it confirms something that we're already kind of predisposed to believing. And so I think the pandemic is a good example of that. And in-group favoritism, which is, right, we believe we favor people who are in our group, and this is not always a bad thing. So you can leverage the strengths of a group or group relationships for public health initiatives. We see that a lot with Black fraternities and sororities and initiatives to improve breastfeeding and colorectal cancer screening and things like that, relying on groups to help reach out to members of their groups. The framing effect, one example I give, I like the book Freakonomics as well. And there they talk about statistics, and one example they give is, you know, if we say 1 in 4 Black men are in prison, and you might hear that statistic in the news, well, that means 3 in 4 Black men are not, right? But we don't lead with that. But that's also an example of how to use asset-based framing, saying, you know, yes, the incarceration rates for people of color in this country are horrific. We want to talk about that, but we also don't want to try to mislead people and make statistics, you know, more alarming than they are. And then authority bias, we talked about this in our group, and you know, Jean and Barb talking about this, which is we're heavily influenced by who is delivering the message. So from a racial equity perspective, within each of these biases, here are some things that you want to ask yourself. So what are your own, start with yourself. What are your own preconceived notions about racial equity? What do you think about people of other races and abilities? If you haven't done Project Implicit and taken an implicit bias test, there are multiple versions of it for different population groups and categories. You should try it out. But some people don't like it. So if you take it and you don't like it, totally cool. But it is a way to uncover your own biases. In-group favoritism, what groups do you belong to? How diverse are your groups? How diverse is your workforce? How diverse is your workplace setting? When you go into a meeting, do you say like, man, it's all white people in here? Or, you know, do you notice when that's the situation? Because I can guarantee as a person of color, like you walk into a room and you're the only person of color, you notice that. Well, you know, what kind of spin are you putting on the data and why are you doing that? And then thinking a lot about who people in your target group trust and whether or not people trust your organization. And if they don't, what are you doing to build that trust? So the last bias I want to cover, and there are a lot actually, if you go to I think it's Vitalist, I put the link on one of the previous slides, but there are tons of cognitive biases. So I'm only covering a handful of them, but groupthink is also really important. Just to think about the fact that we are, you know, influenced by being members of groups, and we want to conform to groups. And so we often will do things that maybe don't make sense in the interest of preserving group norms. But the other reason why groupthink is important is because one of the things that we want to emphasize, and I encourage you all to emphasize, is that racial equity benefits everyone. That if we do things that improve the health and improve disparities among people of color, they have the benefit of improving disparities for all population groups, right? We want to be specific in our interventions and recognize that there's an overall economic benefit, educational benefit, et cetera, healthy community benefit to doing these things. So I'm going to skip that. And then one quick thing, because I'm at time and I want to make sure we have time. My arm timer went off and breakout. Okay, so I actually am not going to do this part, and I will skip these because we're going to look at a message in our group together. So you're going to see this slide in your breakout groups, and this is just a recap of all the things I was just talking about. So you're going to do these things, and you're going to see the message, the same message, the first message that you saw, or some folks the only message that you saw, and you're going to talk about it in the context of these things with some questions that are going to be on your screen. So I'm going to stop sharing so that we can get those breakout groups running.
Welcome back, everyone. I see smiling, laughing faces. I'm hoping that means some people had some really good conversations. And it's now 11:11. We had scheduled to go to 11:30, and you know, we will respect everybody's time. But of course, I always wish that we had more time for this. And we will hang out if anybody wants to hang on a little bit longer. We'll keep the Zoom room open until noon. But that's completely up to you. We'll finish the formal presentation by by noon. And so everyone's back in the room. So why don't we turn it over to Deborah for just a few reflections?
Yes. So I was kind of laughing a little bit because it's my strong belief that quilting groups and grandmothers are an underutilized source of messaging. Tell me I'm wrong. So let's get those hands up again, and we'll just hear from one or two of the groups, please. Sarah Strawbridge has dutifully already done her. Okay, Dr. Rovers, John Rovers. And Rachel, I'm queuing you up next. Shran.
I'm just going to go through maybe one section of it because there was an awful lot there, but I thought we had some really good discussion on storytelling and authenticity of voices, which was talking about things like, mothers who are now relieved that their child was able to get a vaccine now that it's available for 12 and up, that these kids can then start to engage in their, normal sports or other kinds of things. Comments about, again, a parent or somebody who was initially anti-vaccine and maybe has now changed sides due to some personal experience, or maybe a family member who had gotten sick and now sees the results of COVID. And I think the one thing that made the most sense to me was, as somebody said, centering the voice. Who are you speaking on behalf of? Is this a story that you're telling about your own experience or someone else's? So I thought our group had actually a pretty good discussion.
Fabulous. Well, thank you for sharing that, John. Rachel, how about your group? What did you guys center on?
Yeah, we thought that the audience was really for non-public health background local elected officials. And so we really focused there. I think something new that our group would add, we talked a lot about like asset-based, I don't know what the right word is, just making that paragraph more asset-based. So we talked about focusing on we care about the members of our community and really calling out who that is. Calling out that we have the tools to put this pandemic to bed, to give people that feeling like they know or that they have something that they're able to do. And then I thought somebody else, I think it was Aaron, brought up a really good point about how we could even bring in stories that are not pandemic related, but just about how our communities have come together in the past. And, even though this wasn't like a windstorm or a tornado, that doesn't mean that we're not rebuilding and supporting one another, which I thought was really cool.
Great thoughts. I love those. Great ideas. Kelly Sitzig, how about you?
Hi, yeah. So just a couple things from our group. We talked about the sentence that suggested that public or elected officials need to encourage people to do the right things, and how that was a very individualistic approach, kind of like Don had been talking about. So that might be one thing that we would take a look at. Don, of course, had really great words for how to well, first of all, we talked about at her suggestion replacing elected officials with leaders to resonate a little bit more broadly, and talking about how it was their responsibility to protect communities or make sure our communities were safe. So more of that systematic rather than individual approach. And then we also, we talked about storytelling quite a bit. I mentioned the story, a story I heard this morning about the number of kids who have lost a caregiver due to the pandemic. I don't know if you heard that this morning, but which of course was totally heartbreaking. But Don again made the really great point that that actually wouldn't resonate the same with some folks, and that it might be better to focus on the institutional outcome of something like that. So in terms maybe approaching the long-term economic impact of kids losing caregivers, so many kids losing caregivers.
I think those are there are two good points in that group that I think have not been brought up in COVID related messaging, or in general. I think that I've had success with legislators in really reminding them of their role in governance and what they were elected to do, that it wasn't about winning a popularity contest, that they had really some duties to withhold, and that it takes some leadership to execute those. So I liked that you guys touched on the role of governance here, and that is to protect the public, and by making hard decisions a lot. And then I do think there's some space for discussion around the trauma and loss of the folks that were left behind, and the trickle out effect on what that does to communities that experience quite a bit of loss, and going into promotion of health in the workforce. So tying it back to the economic point that Dawn made, studies have shown that between 5 and 10 people are impacted when a loved one is lost, and it's generational, and that exacerbates the 7,000 number by fourfold at least here in Iowa. That's a bigger number. Okay, Nikki Gothrow. That was my French. I got it wrong.
Yeah, that was nice.
Okay.
I'll just highlight a few things we talked about. So for the question, what systems would it affect how people would respond to this message? We said that if it's talking to a rural area, it wouldn't be as effective because people were pretty much back to normal in rural areas. They were interacting with friends and families already. So keeping that context in mind for the message. And then also the term citizen would exclude people with the systems with citizenship status, especially as it relates to vaccines. So we highlighted those things. And then we started talking about who would be the trusted individual and how that might have changed over the past 2 years. How in the beginning we thought it was public health, and now we're not really sure. It would probably be a senior person in a community, but how we've had to kind of identify that person as it changes throughout the past years.
Yes, I think that's an important point. I think that public health and healthcare has kind of fallen behind because we enjoyed the reputations and authority status as being really, really smart people in the room. And that did not work as well this time. And I know that Jean has been looking at use of faith-based leaders too, and how public health professionals can engage those faith-based leaders as they become more central in many communities, or always have been, to influencing the health of their flocks. With that, we have about 10 minutes, and I think we're at the point of wrapping things up. Lena, am I right?
Yeah, we wanted to give Deborah some time to share some examples from her work and how she's used this framing practice and had success with that. And then we just want to, then we'll pitch it back to Jean and Dawn and Barbara for a few closing thoughts. And then we'll again highlight what we have coming up for the rest of this month. So Deborah?
Sure, okay. So my interest in using this really stemmed from the experiences I had in the 2017 session. I was the legislative liaison for the Iowa Department of Public Health. So that means I was the point of contact for state legislators and congressional staff. And it was the shift in Iowa had already been occurring, but in 2016 is when one party became the majority party in both chambers. And so I recognized after our budget got cut by 14%, I had a heck of a time getting policies passed. We really had a rough go of it as public health, that what was usually, I just needed more tools in the toolkit. And I sort of tripped and fell on an article that Jean Matthews had written called Crafting Richer Public Health Messages Using Moral Foundations Theory. And I absorbed it and started using it. And it really just made me better at listening, checking my own lens, and understanding that I too, as a human, have knee-jerk reactions, and that I need to be less set on getting people to believe what I believe and meeting them where they're at, and listening to what their concerns are. So I think that this made me a better listener. I think it made me think through their why instead of trying to impress upon them my why. So really thinking through their lens. And again, they're in a role of governance. So the 2018 session where I really started to change my mindset was one of the most successful sessions that I had. And it was completely because I had adopted this work. And I was able to navigate through using the Authority Foundation, achieving a little technical change in the department's medical cannabidiol program, that any given year would have gone into a technical bill. But that issue had blown up so much politically that I was fighting the sentiment of the Speaker of the House, who was dead set on not having those words uttered or anything relating to the medical cannabidiol program passed. But I pushed and I pushed, and I talked about fairness, that the department didn't want this program. You guys passed this program, and now you, as the authority of governance, need to make sure this program is working properly. And so those were the foundations I really leaned into, and I never would have done that, I think, without thinking through those talking points. It wasn't about care versus harm. The Epilepsy Society and having children who were wheelchair bound attend subcommittees had really been about how the legislation got passed. But by that time, the Care Harm Foundation was just not as involved. But I did use it to get our budget increased again by 8% after a 14% reduction. And a lot of that money came from, a lot of that increase was for money to fight obesity in school-age children and getting the 5210 program up and going and broadly. And there, I used a lot of care harm, and I used it with both parties. The director at the time had, I don't even want to go into the details, but long story short.
Yeah. Why don't we just, I'll break in here and just say, I mean, obviously you can see why we're so grateful to have Deborah as part of this, and then leading our next two sessions where you can really do a deeper dive into issues. And so those are both on the ipha.org/events page. And that's a part of what you signed up for here. So make sure you take advantage of that. Yes, John, we'll send all the slides. So Deborah's leading at least two sessions, depends on how much interest we have. We can hopefully convince her to come back for a third, but she'll be leading those discussions. So make sure you sign up for that. And then, Anne, do you want to talk about the media training we're having at the end of the month? And then we'll turn it over to Jean and Don and Barbara for closing words.
Yeah, so for those of you who don't know, even though I work at the university for my day job, I also do quite a bit with IPHA. And so I am currently facilitating our social media community of practice, which right now is open to any public information officer or social media manager from a local public health agency. There has been some talk of expanding it to other community-based organizations and others. We usually meet about once a month. If you are interested in that group, go ahead and shoot me an email at comms@iowapha.org. Like I said, if you're a PIO or a social manager associated with a local public health agency, we're happy to have you. And then we are also supporting obviously this training and the follow-ups with Deborah, which I will be very excited to be on. And then we are also having a media training for local public health, and that includes both government and agencies that are in the community. So often we are taught as public health, like the media are people who are there to skew your message and light you on fire and uncover scandals that aren't there, when in reality, we should really be having like very beneficial relationships with media and using them to our advantage. And so Kelly Bloomquist from Webster County, who is amazing, and I love her. If you are on the COP calls at all, you know how great she is. We'll be running that. And that is later this month. And that is, you can also sign up for that on the Iowa PHA website. And that's it.
Thank you, Anne. And I would be remiss if I didn't thank Delta Dental Foundation for their support. It was through a grant through Delta Dental Foundation that we're able to do all of this, including the social media community of practice, this webinar, and other work that we've been doing all year to increase our health communication muscles. So with that, Jean and Dawn, Barbara, closing thoughts from you all?
Yeah, just Dawn, if you want to pull up the closing, but let me just say how fortunate all of you in Iowa are to have Lena and her team and Deborah, who knows this material so well, to work with you on that. Very, very exciting thing. Can you back up one slide, Dawn?
I actually don't think I have the slide that you're talking about.
Okay, that's all right. Well, I was just going to say that the reflection is that you folks are living in a historic time. In 20 years from now, the people that you mentor will look at you with awe. That number one, you knew the world before this pandemic. And number two, you were part of the struggle to overcome it. And that will give you credibility that you probably aren't reflecting on now, but you will have. The takeaways are really John Lewis's words, but we have a vital role to play amid this polarization. We can't afford the luxury of contempt or condescension towards those in our communities who don't happen to share our viewpoints. And number three, we have to build the skill sets that I talked about across our workforce. John Lewis, try to find the goodness in every human being. Don't ever give up on that other person. Barbara, Dawn, jump in if you got a comment.
Jean, I think you did it beautifully. I will say Susan Valletta had asked for sort of a one-pager, and I think that one-pager that Jean flashed up very, very quickly, I put a link to that in the comments section that goes back to the Becoming Better Messengers website on the Network for Public Health Law.
And Deborah knows where that is too.
Perfect.
Yeah, I just want to say thanks. I know we're at time, so I appreciated the conversations today and all the interaction, and it's nice to get to work with Deborah again after many years, and Lena, who we share some geography. So I just want to say thanks.
And we learn as much every time we do this presentation from all of the discussions that y'all have. So I was taking mental note of some of the things that y'all were saying. So thank you for that.
Well, thank you all again for sharing your morning with us. As I said, we'll keep the line open until noon if people want to hang out a little bit. And Jean and Dawn and Barbara are extremely approachable. I would encourage you to reach out with them if you want to explore this area further, and maybe perhaps bring them to some of the trainings or work that you all do, and dive a bit deeper. But do please sign up for those sessions with Deborah and our media training later this month. So take care, everyone, and have a great day.
Thank you.